So welcome to the class. We start with today's topic of anatomy module. It's a recall and revise series. So one of you will read 5 questions or 3 slides, and another person will read another 3 slides. Okay.
Yes, sir. Yes, sir.
So Dr. Amrita, start with the first question.
Yes. Question 1. Which of the following structures passes exclusively through the lesser sciatic foramen? Pudendal nerve. Option A, pudendal nerve. Option B, internal pudendal vessels. Option C, obturator internus tendon. Option D, nerve 2, obturator internus. E, sciatic nerve. Sir, nerve 2, obturator internus.
Next question.
Yes. Which of the following represents the correct nerve root of the iliohypogastric nerve? Option A, T10, option B, T11, option C, T12, option D, L1, option E, L2. Sir, option E, L1, option D, L1.
Correct. This is very frequently asked. Iliohypogastric and ilioinguinal now. Very frequently asked. Okay. So we'll see the answers. I think question 1 answer is C, that is obturator internus tendon. Okay. So obturator internus tendon passes through the lesser sciatic foramina, and question 2 is L1 root. Okay. Next again, Dr. Amrita, read this.
The ilioinguinal nerve is a branch of which spinal nerve root? Option A, T12, option B, L1, option C, L2, option D, L3, option E, L1, L2. Sir, option E, L1, L2.
Ilioinguinal now.
Ilioinguinal nerve. L1. L1.
L? It is L1. Okay.
L1.
Both iliohypogastric and ilioinguinal are L1. Okay. Next question.
L1. Yes. Sir, the ductus venosus in fetal circulation serves to connect which two structures? Option A, umbilical vein and inferior vena cava. Option D, umbilical artery and portal vein. Option C, inferior vena cava and right atrium. Option D, portal vein and hepatic vein. Option E, umbilical vein and right atrium. The ductus venosus. Sir, option it will be A. Option A. Option A. Yes.
Correct.
Yes.
So the question 3 is L1, that is ilioinguinal nerve, and question 4 is umbilical vein and IVC will be connected by the ductus venosus. Okay. Again, next, Dr. Amrita, you can
Yes.
finish
Yes,
these
sir.
two.
At which vertebral level does the ovarian artery typically arise from the abdominal aorta? Option A, T12, option B, L1, option C, L2, option D, L3, option E, L4. Sir, I don't know this. I'm guessing I don't know. L2.
Yeah. See, the abdominal aorta divides into 2 common iliac at the level of the L4. Okay. Then just 2 segments above that L2, you will have this gonadal vessels. Okay. And abdominal aorta will also give vessels to the this bowel and all. So all those vessels and their level is also asked. So you remember that you have to read about these, levels and the vessels. You got it?
Yes, sir.
So note down these topics which you need to read. Okay.
Yes, sir. Yes.
Next question.
Question 6. Which of the following structures lies lateral to the internal iliac artery within the pelvic cavity? Option A, external iliac artery. Option B, ureter. Option C, obturator nerve. Option D, internal iliac vein. Option E, lumbosacral trunk. Sir, option B, ureter. A, external
iliac within cavity.
Yeah, pelvic cavity. But see, this common iliac will divide into internal iliac and external iliac. And what will be lateral to the internal iliac artery? Because there will be bifurcation. Okay. No doubt the external iliac will always be lateral. But what lies lateral, immediately lateral to the internal iliac?
Obturator.
Yeah. So you have L2 is the answer which we discussed for question number 5. That is, at what level, vertebral level, does the ovarian artery typically arise? that is at L2 level. And next question 6 answer is obturator nerve. Dr. Sinchana, next 3 slides you continue.
Yes, sir. Pudendal nerve arises from which of the following nerve root combination? A L4 L5, B L5 S1, C S1 S2, D S2 S2 to S4, E S3 to S5, D S2 to S4.
Correct. Next.
S2, S3, S4.
Yeah, remember this is very frequently asked. At some or the other place you will come across this pudendal nerve. Okay.
At which vertebral level does the abdominal aorta typically bifurcate into common iliac arteries? A T12, B L1, L2, L4, and L5. It is at L4 level.
Correct. So by this you must have realized that what they are expecting from you from anatomy point of view. Okay. So you need to prepare from this point. Okay. So question number 7 is S2 to S4,
Yes.
that is pudendal,
Pudendal.
and question 8 is L4, that is the bifurcation of the aorta, abdominal aorta. Next.
Which of the following nerves primarily supplies the skin below the level of the umbilicus? Intercostal nerve, B subcostal nerve, C iliohypogastric nerve, D ilioinguinal nerve, and E genitofemoral nerve. Subcostal nerve.
Skin below the level of the umbilicus, doctor.
So it can be ilioinguinal nerve.
Ilioing.
It is iliohypogastric. No, ilioinguinal will go to the lateral part. No, inguinal region it will go. No doubt, both these iliohypogastric and ilioinguinal are below the level of the, but the most will be iliohypogastric. Hypogastric region in 9 quadrants we have discussed, no, in the
Yes,
first
sir.
lecture. Okay, next.
Which of the spinal cord segments provide the parasympathetic innervation to the urinary bladder? T10 to L1, B L1 L2, C S2 to S4, D T6 to T10, E L4 to L5. It is S2 to S4.
Correct. Yeah, very frequently asked. I told you this. Okay. So this question number 9 is iliohypogastric, and question number 10 is S2 to S4. You can open your old anatomy books. Okay, just go through the
Yes.
figures. Okay, and overview of those particular topics, especially the pelvis, the abdominal, is going to be sufficient, and we have 1 month time. Okay.
Yes, sir.
Next, Dr. Sinchana.
Which spinal cord segment provide the parasympathetic innervation to urinary bladder? Same, sir. S2
Same question
to
repeated. So go for the next question. Yeah.
Yes, sir. Which spinal cord segments provide the sympathetic innervation to the urinary bladder? A T6 to T10, B T10 to L1, C T12 to L2, D L1 to L4, and E S2 to S4. It
Now
is
here they have
T12.
asked the sympathetic. Okay. Parasympathetic we know. S2 to S4. But what is sympathetic?
It is T10 to L1.
It's a T12 to L2.
Oh, okay, sir.
Okay.
Yes, sir.
So remember, once you know parasympathetic, you should also know the sympathetic. Okay. Next.
A 35-year
Doctor, yeah, continue.
A 35-year-old male is undergoing surgery for varicose vein. During the procedure, the surgeon identified gonadal artery and traces it back to its origin. The gonadal artery is a direct branch of which of the following vessels? Renal artery, inferior mesenteric artery, abdominal aorta, internal iliac artery, superior mesenteric artery. Answer abdominal aorta.
Yes. Abdominal
It
aorta.
is a direct branch of the abdominal.
Yes. Dr. Amrita, go
Yes.
for from 13 to 20 you finish now. Okay, up to 20.
Yes, sir. Yes, sir. The umbilical artery is a branch of which of the following vessels? Option A, external iliac artery. Option B, internal iliac artery. Option C, abdominal aorta. Option D, inferior mesenteric artery. Option E, common iliac artery. Sir, options B, internal iliac artery.
Yeah.
Internal iliac.
Internal iliac.
Okay.
Umbilical
Iliac
artery.
artery. Next.
Gonadal and umbilical. ये तो लिख Question 15. A 45-year-old woman undergoes surgery for pelvic organ prolapse. Post-operatively, she reports numbness in the perineal region and difficulty controlling bowel movements. The surgeon suspects injury to a nerve that provides both sensory and motor innervation to the perineum. Which of the following best describes the sensory and motor distribution of the pudendal nerve? Option A, sensory to the lower abdomen, motor to the pelvic diaphragm. Option B, sensory to the external genitalia, motor to the external urethral and anal sphincters. Option C, sensory to the medial thigh, motor to the adductor muscles. Option D, sensory to the gluteal region, motor to the gluteus maximum. Option E, sensory to the perineum, motor to the pelvic viscera.
B. Option B.
B, option B.
Correct. See, pudendal is very frequently asked, either this way or that way. Okay. So
Yes.
pudendal now is very frequently asked. So answer B, it is sensory to the external genitalia and motor to the external urethral and anal sphincters. Okay. Next.
Yes, sir. Question 16. Which of the following structures passes through the deep inguinal ring and is most easily recognized during laparoscopy in a female patient? Option A, inferior epigastric artery. Option B, round ligament of the uterus. Option C, ilioinguinal nerve. Option D, ureter. Option E, femoral nerve. Sir, option B,
B. Round ligament.
Yeah.
round ligament.
Correct. Correct.
Yes. Question 17. Which of the following structures originates from the lateral pelvic wall and inserts into the cervix, upper vagina, providing significant support to the uterus? Option A, broad ligament. Option B, round ligament of the uterus. Option C, uterosacral ligaments. Option D, cardinal ligament. Option E, pubocervical fascia. So just the lateral.
D.
Sir, option cardinal ligaments. Yes.
Cardinal ligament or McIntosh.
Yes. Option D,
Lateral
cardinal
pelvic wall.
ligaments. Correct. Because what is asked, it inserts into the cervix and upper vagina. Okay. And coming from the lateral pelvic wall. Okay. So if it would have been uterosacral, it will not come from lateral pelvic wall. No? It will be attached posteriorly
Yes,
to the
posterior.
sacrum. Okay. Next.
Yes. Question 18. During pelvic nerve dissection in a female cadaver, a medical student identifies the dorsal nerve of the clitoris, which provides sensory innervation to the clitoris. The dorsal nerve of the clitoris is a terminal branch of which of the following nerves? Option A, ilioinguinal nerve. Option B, genitofemoral nerve. Option C, pudendal nerve. Option D, pelvic splanchnic nerves. Option E, inferior hypogastric plexus. Sir, option C, pudendal.
Dental nerve.
Yeah.
Pudendal.
We have just discussed external genitalia supplied by this sensory to the external genitalia pudendal. Yes, continue.
Yes. During question 19, during embryological development, the liver and biliary systems begin to differentiate following the invasion of a specific structure derived from the foregut. The interaction is essential for the proper formation of hepatocytes and biliary ducts. The liver and biliary system are differentiated by invasion of which of the following structures? Option A, Wittline duct. Option B, septum transversum. Option C, dorsal mesentery. Option D, allantois. Option E, urogenital sinus. Sir, option C, dorsal mesentery.
Liver and biliary system, doctor. Liver and biliary.
Allantois.
Where is
Liver
allantois?
not allantois.
Liver and biliary systems, it is septum transversum. Okay.
Septum transverse.
Okay.
You can open the embryology book and just see the figures. Okay. Structures,
Yes.
identify the structures, and in embryology, at what weeks, what happens. Okay. So those particular things you should know.
Yes, sir.
Yes, sir.
And last question, Dr. Amrita.
Yes. Yes, sir. Which of the following nerves is closely related to the psoas major muscles and emerges from its medial border? Option A, femoral nerve. Option B, ilioinguinal nerve. Option C, lateral cutaneous nerve of thigh. Option D, genitofemoral nerve. Option E, obturator nerve. Psoas major muscle. So D,
Genitofemoral nerve.
D, genitofemoral.
Genitofemoral.
Femoral nerve. Dr. Sinchana, next
Yes.
up to 25, finish up to 25 minutes.
Yes. Uh, Blood supply to the midgut is provided by which branch of the abdominal aorta, and at what vertebral level does this branch arise? A. Celiac trunk at T12. B. Superior mesenteric artery at L1. C. Inferior mesenteric artery at L3. D. Renal artery at L2. E. Inferior phrenic artery at T12. It is a superior mesenteric artery.
Yes, it is superior mesenteric artery and it is at L1. Okay. Sometimes they'll give you two options. One will be superior mesenteric artery at L1, another will be superior mesenteric artery at L2. Okay. So they'll confuse. The one who knows very specific will answer correctly. Okay. So the answer is superior mesenteric artery at L1. Okay. So these points, you remember what the theme they are expecting. Okay.
Yes.
Next.
During a pelvic venous dissection in a female cadaver, the left uterine vein is traced to its site of drainage. Understanding the venous anatomy of the pelvis is essential, especially during hysterectomy or when assessing pelvic congestion syndrome. The left uterine vein ultimately drains into which of the following vessels? A. Inferior vena cava. B. Left renal vein. C. Left internal iliac vein. D. Left ovarian vein. E. External iliac vein. It is left internal iliac vein.
Correct, correct. So left side it drains into the left internal iliac. Okay.
Yes.
Next.
A 70-year-old man undergoes abdominal aortic angiography for evaluation of mesenteric ischemia. The radiologist traces the artery supplying the hindgut, which includes structures like descending colon, sigmoid colon, and upper rectum. At what vertebral level does the artery supplies the hindgut arise from the aorta? A. T12, B. L1, C. L2, D. L3, E. L4. It is inferior mesenteric artery, L3 level.
Correct, correct. So what we have seen, aortic bifurcation at the level of the L4, gonadal artery at the level of the L2, and this L3 is at the level of this. Okay,
L2.
and we have also seen just now, previous question, superior mesenteric artery at the level of the L1.
L1.
Okay, so remember these landmarks. Okay,
Yes.
the answer is L3. Okay, inferior mesenteric
Mesenteric
artery
artery.
is at the level of the L3. Next.
A 58-year-old patient is undergoing resection of large polyp in the transverse colon.
Be loud, be loud.
Surgical team discusses the vascular supply to the transverse colon to ensure adequate perforation of the remaining bone. Which of the following arteries provides the main blood supply to the transverse colon? A. Left colic artery. B. Ileocolic artery. C. Superior mesenteric artery. D. Inferior mesenteric artery. And E. Middle colic artery.
Transverse colon. They are asking, no? Transverse colon.
C.
Transverse
Superior
colon
mesenteric.
is from which part of the? Is it from foregut, midgut, hindgut? From where it comes?
It is from midgut,
Yeah. Okay.
superior mesenteric.
But is it direct superior mesenteric or something else? See, midgut vessel is superior mesenteric artery, no doubt. But what is the direct supply?
Left colic artery branch.
No, it is ileocolic, middle colic. Sorry, middle colic artery.
Okay.
Okay.
Yes.
So next, last question, Dr. Sinchana, for you.
During appendicectomy, the surgeon identifies and prepares to ligate appendicular artery to prevent intraoperative bleeding. Knowledge of its origin is essential to avoid inadvertent injury to nearby structures. The appendicular artery most commonly originates from which of the following arteries? A. Ileocolic artery. B. Right colic artery. C. Superior mesenteric artery. D. Inferior mesenteric artery. E. Middle colic artery.
Answer is given.
Ileocolic artery. A.
Okay. Okay. Next, Dr. Amrita.
Yes, sir. During examination of a neonate skull, the clinician assesses the largest fontanelle to evaluate skull development. Which set of sutures forms the boundary of the largest anterior fontanelle? Option A, coronal sagittal frontal sutures. Option B, coronal lambdoid frontal sutures. Option G, sagittal lambdoid frontal sutures. Option D, coronal squamous and frontal sutures. Option E, lambdoid squamous and frontal sutures. Sir, option A.
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 Yes, correct.
Coronal, sagittal, and frontal.
remember skull and pelvis, you should know, okay, the anatomy of the skull and pelvis from the obstetrics. The same questions will be there, various diameters will be asked, okay, various presentation, which is the engaging diameter and all. These are all questions, okay. So here the answer is A, coronal, sagittal, and frontal suture. Next.
Question 27. A newborn is examined shortly after delivery and is found to have congenital absence of the mastoid process. The attending physician notes that the absence of this bony structure may place a nearby neurovascular structure at increased risk of injury due to lack of protection. Which of the following structures is most at risk in this case? Option A, glossopharyngeal nerve. Option B, internal carotid artery. Option C, external auditory canal. Option D, facial nerve. Option E, vestibulocochlear nerve.
D, facial nerve.
Facial nerve, yes.
Yes, the answer is facial nerve. Okay. Next.
Question 28. A 30-year-old male presents with straddle injury and swelling in the perineal region. On examination, the scrotum and penis are markedly swollen, and uterine extravasation is noted without involvement of the
Urine.
thighs.
Urine.
Sorry,
Urine.
urine. Urine extravasation is noted without involvement of the thighs or anterior abdominal wall above the umbilicus. A diagram is provided showing the superficial fascia of the perineum that continues with the dartos fascia and scarpa's fascia. Based on the anatomical continuity and facial boundaries shown in the diagram, which structure is responsible for restricting the spread of urine into the thighs of in this patient? Option A, scarpa's fascia. Option B, dartos fascia. Option C, colles fascia. Option D, campus fascia. Option E, buck's fascia.
Colles fascia.
Colles fascia.
C, colles fascia.
So it prevents the slippage of the urine.
Mm.
Slippage of the urine. Okay.
Colles
So
fascia.
there is colles fascia. So it restricts the spread of the urine to the thighs. This colles fascia. Next, Dr. Amrita.
Yes. Question 29. During pelvic floor dissection, a medical student is asked to identify which of the listed muscles does not insert into the perineal body. The perineal body is described as a central fibromuscular node between the urogenital and anal triangles, serving as a common insertion point for several pelvic floor and perineal muscles. Which of the following muscles does not insert into the perineal body? Option A, bulbospondiosus. Option B, superficial transverse perineum. Option C, levator ani. Option D, external anal sphincter. Option E, ischiocavernosus. Option E.
Bulbospongiosis.
No, E is correct. Ischiocavernosus.
E.
Ischiocavernosus will not come. Okay.
Yes, sir.
That will
Yes,
not
sir.
get inserted into the perineal body. Okay.
Yes. Yes.
Dr. Amrita, next.
Yes, sir.
Last question for you.
Yes, sir. Question 30. A 28-year-old woman presents with 7 weeks of amenorrhea and vaginal spotting. Ultrasound is inconclusive for an intrauterine pregnancy. An endometrial biopsy is performed and the pathologist notes glandular hyperplasia with nuclear atypia and secretory changes consistent with area stellar reaction. Area stellar reaction is typically seen in which of the following conditions? Option A, endometrial hyperplasia. Option B, endometrial carcinoma. Option C, ectopic pregnancy. Option D, PCOS. Option E, atrophic endometrium. Option C.
Ectopic pregnancy.
Correct.
Option C.
Yeah. Dr. Sinchana, next question.
Yes, sir. 27-year-old primigravida undergoes a forceps-assisted vaginal delivery. During post-delivery examination, she is found to have perineal tear involving less than 50% of external anal sphincter thickness with no extension to internal anal sphincter or rectal mucosa. According to RCOG classification or obstetric anal sphincter injuries, what is the grade of injury? Grade
Less than
A,
50%.
yes. Grade 2, grade 3A, grade 3B, 3C, grade 4. It is 3A, grade 3A.
Yeah.
Less
So
than-
what is 3B?
It is more than 50%.
More
and,
than 50%.
And what is 3C then?
completely
We
uh,
had complete
transit.
guideline on this. Okay, we discuss in detail everything because this is frequently asked. So what is 3C?
It is complete transactions, sir. No fibers are left intact.
It is external plus internal anal sphincter is grade 3C. Okay.
Yes.
3A is
Less than
external anal
50%,
sphincter less than
external
50%. External anal
external
sphincter more
sphincter.
than 50%. External plus
Mhm.
internal is 3C. And grade 4 when the anal mucosa is also torn. Okay.
Yes.
So that finishes the today's topic of recalls. Thank you.